Hello everyone. So in this lesson we'll be discussing ear infections, what is called otitis externa. First I'll do an introduction on otitis in general, and then the diagnosis and treatment is only regarding the otitis externa. Otitis is one of the most common causes of consultations in veterinary practice. So what is an otitis? An otitis is an inflammation of the ear canal. It can present as erythematous otitis when there's an inflammation of the ear canal without secretion, as erythemato-ceruminous otitis when there's inflammation of the ear canal and presence of abundant ceruminous exudate, as suppurative otitis when there's erosions in the ear canal and pus, and as stenotic otitis when there are hyperplastic changes of the ear canal. An otitis can be divided in otitis externa, otitis media, and otitis interna. An otitis externa affects the external auditory canal from the pinna to the tympanic membrane or eardrum, and it is the most common form of otitis and what we'll focus on today. We can also have an otitis media when there's an inflammation or within the middle ear, often is secondary to an otitis externa. At last, an otitis interna is an inflammation of the inner ear, usually results from an extension of an otitis media. What we need to know is that an otitis is usually the manifestation of an underlying disease, rarely is a local phenomenon alone. We have predisposing factors that increase the likelihood of developing otitis, as the conformation of the ear, humidity, inappropriate cleaning, irritant treatments, and excessive hair growth in the auditory canals. These help the settlement of the primary factors that are responsible for the original inflammation, as ectoparasites, allergic dermatitis, keratinization disorders, pyoderma, autoimmune dermatosis, foreign bodies, and tumors. If we are not able to correct the otitis on time, the accumulation of cerumen within the auditory canal is the perfect environment for the growth of yeast and bacteria, as Malassezia and Staphylococcus. These contribute for further inflammation and the perpetuation of the otitis. Also, extensive epidermal and sebaceous hyperplasia, ulcerations, and a subsequent otitis media can also happen in advanced cases and further contribute to clinical signs and recurrence of the disease after apparently successful treatment. The clinical signs the owner notices and leads him to the clinic usually are head shaking and ear scratching, unpleasant smell, erythema of the ear canal, so redness in the ear. It is very important, first of all, that the vet talks to the owner to see if there's a hint of what could be causing the otitis. So age of onset, young animals are predisposed to ectoparasites, adults are more predisposed to allergic otitis, old animals are more likely to have tumors or autoimmune diseases behind these otitis. Development of signs of seasonality. So an acute unilateral otitis is more likely to be caused by a foreign body. Where I come from, this kind of herb that you can see here in the image is a very common cause of otitis. If it is recurrent and happens every spring, it is likely that is an allergic otitis. If the otitis develops slowly and in only 1 year, it is suggestive of neoplasia. Contagion. If there's more than one animal at home and both are with otitis, it is often caused by ear mite infection. Environment. If is the dog exposed often to foreign bodies like these herbs that I've talked about? Does the dog swims often and as frequently excess of humidity in the ear canal? In cats, the cats should be studied for FIV and FeLV infection, as chronic otitis externa is often linked to these infections. It is especially important that in a dog with otitis we examine also the ventral and skin fold areas, including feet and the anal area, for signs of erythema that would suggest atopic dermatitis, So these areas that you can see here in the image on top. After the physical examination, we are going to dive in the problem that led the dog to the consult in the first place. First, we need to do an examination of both ears with an otoscope, examine both ears even if the problem seems to be only in one. In dogs that are in extreme pain and refuse the examination, may be necessary to sedate them to actually perform a good examination. This examination is used to assess the presence of foreign bodies, the presence of any discharge, how's the ear canal, if there's any type of stenosis or ulceration, the appearance of the tympanic membrane, if it is intact or not, and the presence of tumors or polyps. Next, it is necessary to take a sample of the ear canal and cerumen with a cotton swab, place it onto a glass slide and see it at the microscope to determine the microorganism causing the infection. Direct examination of the cerumen should be performed every time we suspect the parasitic cause as ear mites. If ear mites are present, you should see these little organisms at the microscope as the image on top. And why do we need to know what microorganism is causing the infection? Well, because it helps to choose the right medication to treat the inflamed ear canal. It is also helpful on follow-up consults for assessment of the efficacy of treatment. In case of infection, there may be Malassezia yeast overgrowth or cocci, usually Staphylococcus pseudointermedius. You can see the Malassezia here in the image appearing elongated, whereas Staphylococcus is round. It is important to note that we may not see any microorganisms at all and use this as an examination to see the appearance of the cells in the ear canal. In cases of atopic dermatitis, there can be increased numbers of squamous epithelial cells, but no evidence of microbial infection. All these steps are used to know what is the cause of the otitis. So in case of infection, without knowing the specific infectious agent present, we won't know which medication to use. It is also possible that it is caused by a foreign body, a polyp, a tumor, etc. And in those cases, the treatment is different, of course. Also note that it is important to examine carefully if the tympanic membrane is intact, since certain medications can result in ear loss if it is ruptured. So perform a good otoscopic examination before treatment and, if necessary, sedate the dog to do so. So with the treatment, we want to resolve the primary cause of otitis, so parasites, atopic dermatitis, foreign body, relieve the inflammation and eliminate any microbial infection, if any. Cleaning facilitates the examination of the ear canal, removes material that can shelter microorganisms, and inactivate topical medication, in particular the biofilm. Removes small foreign bodies, toxins, and degenerated cells. So following the application of the ear cleaner, Autodine is a good option. The ear canals should be massaged for 60 seconds using a gauze. You have then to wipe away any discharge from the ear canal. The selection of the topical antimicrobial should be based on the results of the cytological examination. Many dogs will have more than one type of infection present, for example, bacterium and fungus, or two kinds of bacteria. This situation usually requires the use of multiple medications or a broad spectrum medication. Usually the products commercially available have a combination of an antifungal, antibacterial, and glucocorticoid, and some also have antiparasitic effects. If there's a foreign body, wax plug, or parasite lodged in the ear canal, it will be removed. Systemic therapy is not usually needed, but in cases where the dog is very painful and the owner can't apply the topical medication, we can use systemic glucocorticoids for 2 or 3 days to resolve the inflammation and pruritus, and then change to a topical therapy when the dog tolerates it. Most uncomplicated ear infections resolve within 1 to 2 weeks once appropriate treatment begins, but severe infections or those due to underlying conditions may take months to resolve or may become chronic problems. Overall, it is very important to identify the underlying disease. Many dogs with chronic or recurrent ear infections have, for example, allergies, and for that reason, if an underlying disease is suspected, it must be diagnosed and treated, or the pet will continue to experience chronic ear problems. But to resume, nearly all ear infections that are properly diagnosed and treated can be successfully managed with the appropriate treatment and targeted to the cause. There's a lot more I could talk about this topic, but I'll probably do one other video, for example, about atopic dermatitis in the future. But that's it for this time. And if you have any questions, please leave a comment below.